Ladies and gentlemen, on behalf of GIERAF, our organization, I would like to thank the organizer of this meeting for giving us an opportunity to talk about our organization named GIERAF. GIERAF is, in English, Inter-African Group of Study, Research, and Application on Fertility. As we know, infertility is a dramatic situation in Africa's setting, in sub-Saharan Africa. Because of their attitude, they like have baby, but have many babies. So infertility is a very terrible drama in this setting. It's a big problem in this area, also because of the prevalence of infertility in our region. The prevalence can climb to 30% in some areas. Another problem is that the access to best care of infertility is very difficult in this area. Drug costs a lot, and also people are poor, and also the lack of facilities where they can have good care of infertility. That's why a group of gynecologists and biologists in sub-Saharan area founded GIERAF in 2009 in Lomé. GIERAF regroups gynecologists, biologists, midwives, and also everybody involved in infertility domain. Many members of GIERAF are in the countries located in Central and the eastern part of Africa, in sub-Saharan area. Nowadays, some of our members are also members of IFS. The objectives of GIERAF is to promote the prevention of preventable cause of infertility, mainly sexually transmitted infection, and also postpartum and post-abortum infection. To promote also the contraception, because in most cases of infertility in our area are due to infection. Also to promote the training of the personnel in assisted reproductive technology. We know that for ERT, you have to have the equipment, drugs, and mainly a qualified personnel who can treat the problem of infertility. GIERAF promotes also the interaction with international learned society to share their experiences with our members, and also to use updated information to the population and also to the care fertility provider. The research is also among our priorities because we are located in sub-Saharan area with our specificity. So some research are set to try to have information and to try to have solution to that problem. Another aspect of our activity is to advocate with political authorities, because we have many problems of health in our region. The problem of infection, the problem of natality. So most of the time, the problem of infertility is not the priority for many deciders in our area. So we have to advocate to improve the situation of the couples who have a problem of infertility in terms of fertilities, and also to organize insurance, medical insurance, to better the accessibility of this population to fertility cares. To meet our objectives, GIERAF organized periodically meetings, mainly the Congress. Apart from the Congress, we have also workshops, symposia, webinars, mainly when we are on the period of COVID pandemic. Presential meeting wasn't possible, so we went through webinars. And also GIERAF organized postgraduate education. For some countries, through some university, we organize postgraduate education. Some members of our organization wrote this review, Infertility in Africa. This review gave some relevant information about infertility in our area, so we can combine what you have from worldwide and the reality of our region. Since 2009, where GIERAF was founded, till now, we have organized 7 congresses. The third was in Togo in 2009, where GIERAF was founded. The second in Cameroon. The main theme was assisted reproductive technology in Africa. As I said, we have not very many facilities that provide assisted reproductive technology. And the sub-theme was tubal infertility. In our region, 75% of the cases of infertility are of tubal origin due to infection, as I said, postpartum, and also sexual transmitted infection. So it was a problem. Among the priorities of our activity are in reproductive medicine. The second was in Benin. It was with the theme infertility management. In the same vein, how to improve the quality of care in our region, and of subterm, ART of low cost. The problem of our population is the poverty, and also the problem of the lack of medical insurance. So we are looking for the ART who have a low cost to be affordable for many population in our region. The fourth was in Dakar, infection and infertility. Again, the problem of infection and new technology in assisted reproductive technology. The fifth was in Congo, the main infertility in Africa. You know that in our region, if we have the problem of infertility, most of the time, they see the woman. The female partner are responsible for many our countries. Because of updated information, more and more time we realize that the man is also responsible of infertility as the female partner. And the problem of myoma. Myoma is one of the most frequent problems among the patients of infertility. Almost 30% of our patients have the problem of myoma. Big myoma and also numerous myoma. So that's the problem. We are among our priorities too. The sixth was about ethics and infertility. You know the role of ethics in our practice. And the seventh was in Cameroon, update infertility management. And also the problem of endometriosis and adenomyosis we had in Ivory Coast. Endometriosis and adenomyosis wasn't more frequent in our country because of the diagnosis wasn't very, very well. Nowadays, with endoscopic and also ultrasonograph, we notice that many cases of adenomyosis and endometriosis are diagnosed in our area too. And the seventh was about active management of infertility and also infertility preservation. That is the hot topic around the world. The eighth Congress was planned for DRC because it failed because of the COVID pandemic. Each of our Congress are led with an eminent personality in domain of infertility in reproductive medicine, and also many scientists around the world are invited to share their experiences with their colleagues in GIERAF. Apart from Congress, we have also workshops who are organized. I say that workshop during the Congress and outside the Congress, and the webinars too. As I told about the webinars we had with IFFS in 2020. Some research are also set. African spermogram and myoma was the subject of research, but it continued. To improve the quality of care in some clinic in our area, we created a label GIERAF for the quality. Some of clinics of the members of GIERAF were awarded for this label. To train the members of GIERAF is also our preoccupation. So some members are trained in India. Thanks to Max Foundation, they are sent to be trained there. The members from Congo, Republic Congo, DRC, Cote d'Ivoire, Mali, and the others. Those days, there's a new application, the Mac Foundation had sent some information about application of the new members who want to go to India to be trained there. Recently, we see that here in Lomé, in the clinic Biasa, they created a center for training in some aspect of ERT and also endoscopy in Lomé. That's a very good thing for us. We can be trained here in Africa instead of going abroad. For our activity, we can say that some countries recognized what we have done. The members of GIERAF was awarded in 2015 in Brazzaville by the president of Congo, by the members, the Medal of Merit for Congo, the Congo, Republic of Congo. The evaluation by ANARA, African Network for Registering Assisted Reproductive Technology Activity, show that assisted reproductive technology access is very low in Africa. So we had to improve the quality of the number of centers involved in this domain. And we can say that the lack of medical insurance and also the poverty of the population make that ERT is unaffordable in our region. Thank you very much for your attention.